Welcome to another edition of the Ministry of Health Weekend Review. Here is a recap of the past week. On February 3rd, Honorable Dr. Frank Anthony, Minister of Health, held a productive meeting with Kim Ava Dixon, the PAHO WHO representative to Guyana, regarding the improved health of women and adolescent girls in situation of vulnerability project. Her team, along with other various program directors and key officers from the Ministry of Health, also evaluated the implementation of the ARTS initiative in the country with 89 sites available. The ARTS technical package offers practical interventions to strengthen the management of cardiovascular risk factors in primary health care, aiming to prevent heart attack and stroke. The said day, Dr. Anthony met with the British High Commissioner Jane Miller. The discussion focused on strengthening health sector collaborations between Guyana and the United Kingdom, with emphasis on key areas of mutual interest. Later that day, the Health Sciences Division of Ministry of Health launched the first batch of the Patient Care Assistant Training Program. Over the next 4 months, the program will train more than 100 individuals from across Region 4 in various aspects of patient care. Additionally, the Patient Care Assistant Program has already been decentralized to Region 1, 3, 5, 7, and 9, with plans to expand to other regions in the upcoming months. On February 4th, the Minister of Health attended the certification ceremony for the GPHC Pathology Laboratory. The laboratory has been certified in accordance with the local standards, Guyana National Bureau of Standards, GYS 170-2021. Speaking at the ceremony, Dr. Anthony highlighted that the laboratory is not only equipped with state-of-the-art technology, but is also pioneering services such as telepathology.
That's really able to do telepathology. And we are probably one of the first laboratories in the Caribbean that is offering these types of services.
On February 5th, the Health Minister was joined by his Permanent Secretary, Program Directors, and Managers for the 100th sitting of the 12th Parliament for Budget Estimate. After 2 hours of deliberation, the National Assembly approved the estimate of revenue and expenditure for the fiscal year 2025 in tune to $143.2 billion Guyana dollars for the health sector. During yesterday's session, the Minister of Health disclosed that the health sector will see a 75% increase in employment this year.
Because we have been doing a lot of training, so you will see us adding a lot of new staff in the clinical areas. So for example, we have currently in our training programs about 3,000 persons, and this year we'll be graduating at least 805 persons from the nursing assistance program. So they will come on staff. And the nurses that have been in training for the last 2 years, we expect them to graduate next year, and that's about 1,000 persons.
He also reiterated the ministry's continued efforts to ensure that its citizens have access to quality health care at all its health centers. Currently, the ministry manages 159 health centers across the country. Dr. Anthony also announced that the Ministry of Health will soon be administering the influenza vaccines to healthcare workers and the elderly who are deemed more at risk during the flu season.
This year, we will start by also giving influenza vaccination, and we would give them first to the healthcare workers and to older people in our population. So there are lots of new things that we're doing with our laboratories.
That's all for this week's edition of the Weekend Review. Stay tuned for more updates as the ministry continues its work to improve healthcare delivery in Guyana.